Hi everybody, it's Becky. Just making another video today since I'm home on recovery, bored, kind of stressed out. I'm supposed to be sleeping and like taking care of myself, but I don't know what to do with myself. There's only so much TV, iPad, so many things you can do before you're just stir crazy. So I thought I'd just make a video and talk to you guys a little bit about what's going on with me. When I first had my troubles with my lap band, I decided to look for a DS surgeon because I heard that that was the best surgery, the most long-term, people lose the most weight. And I thought, if I'm going to do a revision, I might as well get the best of the best, right? So that's why I found the surgeon that I went to. But he kind of discouraged me against the DS. He said that it would cause a lot of acid reflux after removing the band, but he said he'd go ahead and try to submit it to the insurance company. And when it came back, they said, oh well, they denied it because you have to be a 50 BMI or above. He says, but they do say that you can get the gastric bypass. So then that's when I said, okay, let's go for it. So I stuck with him, but he's like an hour and a half from me, an hour and a half drive. So we went ahead and, I just got through with my surgery. The problem with that is it's very difficult to drive an hour and a half whenever I need to go to the visit. Like next week is my 2-week checkup and I have to drive an hour and a half and miss work and everything. So I wanted to see if I can maybe switch my care over to a bariatric surgeon here in the area. But the guy that did my original surgeries office is closed down now. And the only other office is within my area, like within a 20-minute drive from here. They are actually charging patients $500 to be their patient. To be a part of their program, you have to pay $500 and it's not billable to insurance. And I just think that's really shitty that they're preying on bariatric patients that need a new doctor, that just need follow-up care. Like all I'm going to need to do is just go in. I'm going to have to drive an hour and a half to have my surgeon spend 5 minutes with me and say, oh, your incisions look great, everything looks great, thanks for coming. And then I have an hour and a half drive back. In the meantime, I have a lot of work to catch up because I've been out of work for almost 2 weeks. So that's all the visit's going to entail probably. He didn't spend a lot of time with me the last time I was there. So, I don't know with gastric bypass how much maintenance I'll need. But $500 just to be a part of their program is what they say. Seems absolutely like they're just ripping people off. All I need to do is go in there and get checkups, I guess. With gastric bypass, those of you that have gastric bypass, can you tell me how often you have to actually go to the doctor? Is it worth it for me to pay $500? Because unfortunately, I live in a northern part of Colorado, and that is the only place up here. I would have to drive a half hour or an hour or more to the nearest bariatric surgeon. So this is really my only choice up here. And so that's why they get people that way. They know you have no choice. And if you want aftercare, you have to pay $500. The only reason that I'm looking for a bariatric surgeon up here is because what if something happens? What if something happens and I need surgery and I need a bariatric surgeon, but mine is an hour and a half away and I can't get there quick enough and I need someone up here? What if I have complications of some kind and I need to go to the doctor? I have to have one nearby, but $500, you guys? I know I need to get my labs checked, once a year? Or is it more often than that? I'm not sure. Can my, regular physician handle my checkups, do you think? Because I just don't want to be ripped off. I just feel like it just made me so mad that they do that to people. Like when I first looked into them before I went to the surgeon I went, because I was just thinking about getting the band removed. But then the more I started thinking about revision and DS, that's why I went elsewhere. But even if I would have went with them and had surgery with them, they still would have charged me $500 to be their patient, even though my surgeon's office closed down and I had no choice. So I don't understand what their logic is behind that. You know, they're making a lot of money on these surgeries. They're doing really well. You'd think they'd be okay, you know. And then I'm just not really happy with my new surgeon's office because, you know, most surgeons, I don't know, you guys probably have had some that are wonderful, but I've heard a lot of people that say their surgeon does not really have a lot of bedside manner. They're surgeons. They're not really like, I don't know. Mine isn't. I mean, he's nice and all, but he doesn't take a lot of time with me. Um, and he didn't even call after I got home from surgery. I thought maybe someone would call me, like from their office at least, and ask how I'm doing. No one called and checked up on me at all. And the girl that works the front desk, it's like a two-man office. There's a receptionist and there's the surgeon, and they just handle it all. There's no program attached to them except, you know, going through the hospital. But their particular office is just two people. So I know they're busy and everything, but she didn't even take the time to like do anything. Well, I got some paperwork that I needed her to sign for my short-term disability that I applied for. And she said it would be $20 to do the forms. So I gave her $20 when I was there at my last appointment. And then I got another couple of forms in the mail yesterday saying I needed, you know, the surgeon's office needed to fill this out. She tried to tell me that I owe her another $20 for it because they're new forms. And I'm just like, you want another $20 to fill out one form and fax it to them for me? I said, I don't understand why. I go, that's just a follow-up of the other forms. They needed more information. She goes, well, they look like new forms to me. She never once asked me how I was feeling, how I was doing in my recovery, nothing. And it just makes me not want to go there now because she was so rude to me. I mean, it's like these places just want money from you. And it's like, I just had this huge surgery, and obviously your surgeon is going to get a lot of money from my insurance company and myself, and apparently he doesn't pay her enough. She has to charge $20 on the side to just sign a piece of paper for my work. And so I'm really angry for the way she treated me. I don't know if when she's gonna get it done. It only takes her 5 minutes, you know, to fill out a couple things and fax it. But she treated me really rudely, so it made me want to move to a surgeon near here. But when I found out that there was a $500 fee just to be their patient, I don't know. If you guys have any thoughts on what I should do from here, you know, if you think that my general physician will be sufficient from here on out unless I have an emergency, because I think that's outrageous, and I don't like to drive an hour and a half to just be seen for 5 minutes and be told that I'm fine and pay your $40 copay and treat me like crap because I asked her to sign one piece of paper. Tell me what your thoughts are on this, guys. This 2-week checkup, I don't really know what he's going to do. He's probably just going to ask me how I'm feeling. He's going to look at my incisions, which they're all looking great. And then he's probably going to let me go. And I'm going to lose 3 hours of my day for it. So tell me what you guys think. I just need your opinion. Thanks. I'll talk to you guys soon. Bye.